Welcome to my YouTube channel, guys. So, आज ਆਪਾਂ डिस्कस ਕਰਾਂਗੇ टाइप 1 डायबिटीज mellitus and टाइप 2 डायबिटीज mellitus and ਇਹਨਾਂ ਦੋਵਾਂ ਚ difference ਕੀ ਆ and what are the complications of those. Type 1 diabetes mellitus is a insulin dependent diabetes mellitus. This is also called juvenile diabetes mellitus. ਮੈਂ ਕਿਦਾਂ ਯਾਦ ਰੱਖਦੀ ਆ that this is a childhood diabetes mellitus. Like ਬੱਚੇ ਨੂੰ by birth ਹੀ diabetes mellitus ਹੁੰਦੀ ਆ. Next is type 2 diabetes mellitus. Type 2 problem is you. So type 2 due to our lifestyle ਜਿਹੜੀ ਸਾਨੂੰ diabetes ਹੋ ਜਾਂਦੀ ਆ in adulthood. So type 1 ਦੇ ਵਿੱਚ priority ਕੀ ਆ? That is giving insulin is the priority, not the diet modification. So in case of type 2 diabetes mellitus, what is the priority? Priority is diet modification is the priority. So if I ask you, in case of type 1 diabetes mellitus, what will be the priority? Insulin or diet modification? Insulin is the priority. In case of type 2 diabetes mellitus, what is the priority? Insulin or the diet modification? Diet modification is the priority. Discuss करेंगे अपन इन the complications most tested. Type 1 diabetes mellitus the complication are that is diabetic ketoacidosis ਜਿਹਨੂੰ ਆਪਾਂ DKA ਵੀ ਕਹਿ ਦਿੰਦੇ ਆ and type 2 diabetic mellitus the priority kia, that is HHNS. Case of diabetic ketoacidosis, which is a complication of type 1 diabetes mellitus, ketones are present, increased level of ketones in the body. But in case of HHNS, that is water is missing, severe dehydration. In case of DKA, blood glucose level is more than 250. So of HHNS, blood glucose level is more than 600. In case of DKA, diabetic ketoacidosis, ketones are present? Yes, ketones are present. But in case of HHNS, ketones are present? Let's break it through the name. That is hyperglycemic, hyperosmolar, non-ketotic syndrome. Non-ketotic means no ketones present in the HHNS. In case of DKA, metabolic acidosis is present? Yes. In case of HHNS, metabolic ketoacidosis is present? No. In case of DKA, small breathing and fruity breath is present? Yes. But in case of HHNS, that's not. Guys, these are the complications of type 1 diabetes mellitus and type 2 diabetes mellitus. But the priority of these two conditions are same. What will be the priority when you get the DKA patient and HHNS patient? ਸਭ ਤੋਂ ਪਹਿਲਾਂ ਆਪਾਂ ਕੀ ਕਰਾਂਗੇ? The priority is giving IV fluid, isotonic fluids. But insulin ਦੇਣ ਤੋਂ ਵੀ ਪਹਿਲਾਂ check potassium level. ਜੇ potassium level fluctuate ਹੋਇਆ ਆ, correct the potassium level, then give the insulin. Check blood sugar level, and if blood sugar level is too low, then give dextrose too. Let's say in case of SATA questions, if they ask you what will be the treatment of DKA or HHNS, then in case of SATA question, you will check the blood glucose level. Yes, that will be true. You will give the insulin to the patient. Yes, you can give the insulin to the patient. You will check the potassium level. Yes, you can check the potassium level. You have to give the isotonic fluids to the patient. IV fluid. Yes, you will give the isotonic fluid to the patient too. Okay, in case of treatment, ਜੇ ਮੈਂ ਇਹਨੂੰ priority wise divide ਕਰਨਾ ਹੋਏ, the first priority is in both case of DKA and HHNS, that is rehydration. Give isotonic fluid to the patient. Second priority is giving insulin, but before insulin, check the potassium level. So what will I say? Like the second priority will be check the potassium level, and the third will be give the continuous insulin, and the fourth one is check the blood glucose level. Blood glucose level, if you see the blood glucose level is way too low, then add the dextrose solution. Okay, give me the answer of this question. And the question is, a nurse in the emergency department is caring for a client with type 1 diabetes mellitus who present with a blood glucose level is 580 mg per deciliter. Deep, rapid respirations. Urine is positive for large ketones. The healthcare provider prescribed the following interventions. Which order should the nurse implement first? The option number 1 is begin IV infusion of regular insulin at 0.1 units per kg per hour. Option number 2 is administer 0.9% sodium chloride IV bolus. Option number 3 is obtain the potassium. Option number 3 is obtain the potassium serum level. And option number 4 is draw ABG. What do you think? What will be the priority and answer according to the question? Give me the answer in the comments. ਤੁਹਾਨੂੰ points ਹੀ ਦੱਸੇ ਹੋਏ ਆ main points that how we can differentiate between these two conditions, and I hope ਕਿ ਤੁਹਾਨੂੰ ਸਮਝ ਲੱਗੀ ਹੋਊਗੀ and ਤੁਹਾਨੂੰ ਜ਼ਿਆਦਾ confuse ਨਹੀਂ ਕੀਤਾ ਹੋਊਗਾ. And that's it for today guys, and thank you for watching my video. Bye.